Welcome to the Confident Patient in a New World. I'm your co-host, Beth Myers, founder of 2x2 Health and co-author of The Confident Patient. I am joined today with my co-author and business partner at 2x2 Health, Wendy Benson. In this video series, we're continuing the important conversation that we first introduced in our book. Often we talk with medical professionals to garner insights for those of who are patients or caregivers, or maybe both, to confidently navigate the changes in today's healthcare. With us today is Brandy Hatcher, who has her doctorate of nursing practice and is a nurse practitioner for Rush University Medical Center and 2x2 Health. Wendy and Brandy, take it from here.
Thank you, Beth. And Brandy, we're so excited to have you here today with us. Thank you so much.
I'm excited to be here.
Beth and I, kind of being in the medical community, are familiar with the nurse practitioner role, but some people aren't. If someone says to you, what is a nurse practitioner? How do you explain that to them?
Shockingly, I get that question a lot. I think there is a confusion because they hear nurse in the title and they think, oh, I have this appointment, someone's going to be checking my blood pressure, but nurse practitioners do a lot more than that. So nurse practitioners are providers. We listen to the history of what's going on. We develop a plan with you to address what's going on, and we do whatever needs to get done to resolve those problems or concerns. So we write orders, we prescribe medications, we collaborate with your other providers. So we'll talk to your other physicians or your physical therapist or your caretakers, your family members to just help take care of your needs.
And so when someone says to you, I have an appointment with a nurse practitioner, how is that different from a physician, or what do I expect? How do you describe that?
Yeah, so honestly, you would treat that appointment the same as you would with your physician. You would come in with your concerns, and we would come in with our concerns of, looking at your chart or reviewing what's been done or what hasn't been done, kind of what we need to do to make sure we're maximizing your care. I think having a plan when you come in to discuss with us is always great. Also, you would do the same if you're going in to meet with a physician. So honestly, you would treat it the same.
Yeah, I always tell patients, if they want to get in to see a doctor and we're offered a nurse practitioner, maybe the physician's booked out too far, I always say, absolutely, we're going to take the nurse practitioner role because you're working collaboratively with a physician. So I absolutely think the sooner you can get in with somebody, the better.
Yeah, the difference obviously with the physician is they've done more school. Now I've done my doctorate in nursing, so I have my bachelor's degree, I have a 2-year master's degree, and then I have a 3-year doctorate degree. But a physician's still done more schooling than me. So if there's something confusing for me or something that I have less experience in, I'm obviously going to speak with your doctor or a specialist on the topic to make sure that we're meeting your needs and we're not glossing over anything important.
Great. And so when people talk about the importance of a primary, a relationship with somebody in primary care, I think for some people that's a little bit confusing and may think that primary care is more specific to a certain age. Can you describe the importance of primary care no matter how old a person is?
Yeah, primary care is really important. Honestly, it's gonna help keep you out of other specialties offices down the road. You see a primary care doctor as a child. That's where you get your immunizations and your well child checkups. As an adult, we make sure your screenings are up to date, so you're not missing your pap smears, your colonoscopy, your mammograms. You're up to date on your tetanus in case something happens. And then as an older adult, there's more immunizations that you're supposed to get. And then you continue those screenings, and then you can also discuss goals of care and what your plan is as you age and as maybe more comorbidities or disease processes pop up. So it's really important just for your overall quality of life to really improve how you feel.
I find that when people have a nurse practitioner or physician that they're comfortable with, someone in this role, kind of the quarterback of your healthcare, when something comes up, you call them and you feel like you have a relationship with them. If you don't have a relationship with someone, you don't know who to call or what to do. And then you kind of sit on it and then it escalates and then you get into some trouble. So I absolutely agree with you that, we need to make sure that people are going to their general practitioners, nurse practitioners throughout the whole, lifespan. So they have those relationships and they can call when needed.
Yeah, especially for things that might be more uncomfortable to talk about. So mental health, if you're having feelings of sadness or depression, it's a lot easier to talk about those things with someone you feel comfortable with than doing a cold call to someone that you don't know. And similarly, if you have something that you might find embarrassing physically that you don't really feel comfortable talking about with, it's a lot easier if you've already established with someone.
Absolutely. And then cold call. So now you're calling someone and now you have to wait 3 weeks when you're depressed. Mm-hmm. That is not a good place to be in.
Yeah, agreed.
Yeah.
And so, Brandy, you touched on this when you mentioned the various, specialists that exist in healthcare. When a patient and their family is trying to, making sure those specialists are connected and communicating with each other, like, how do you recommend that happen for people?
Yeah, I would first and foremost, trying to have all of your care within one system really helps, because each system generally has its own medical record and uses its own medical system. And so it's easier to see those notes and to speak to those providers if you need to something. So for instance, someone's going to go in for surgery, but they're on an anticoagulant or blood thinner. But they were put on it by their cardiologist, but the primary care doctor is the one that's going to be doing their pre-op. It's a lot easier if we could just send a message to the cardiologist about whether or not we should stop that blood thinner or anticoagulant versus trying to reach someone in a different system over the phone. They might not be in office and playing phone tag back and forth trying to reach them. So if you can get all your care in one system, I would recommend that. But if you can't, if the best cardiologist is in a different system than where your primary care doctor is, who you love, then just making sure that those notes are getting faxed over and that you're updating each physician or each provider on the meds that you're on, any changes that have been made since your last visit. That's really important.
Yeah. How do you a couple of months ago, we did a video on how to set up MyChart. We noticed that only 25% of Americans are using MyChart. I love MyChart. It gives me a way to really communicate to the healthcare team. How do you like it as a provider? Does it seem to help you get to your, talk to your patients and answer their questions quicker?
Yeah, I can see my chart message in between patients. I can address it really quick. Generally, phone calls I have to do either before the day starts, during a lunch break, or after the end of the day, because there's always a little bit of phone tag, and it just it takes a little bit longer. So you have to make sure you're allotting enough time. But in my chart question or message, I can read, I can decide if I have enough time at that moment to look at their chart and take care of whatever it is that they need. And it can be really quick. So I really love it.
Great.
And that kind of feeds into what I was thinking of next in terms of what families of patients can do and what's helpful to you and the other members of the medical team. It sounds like, anything like a MyChart system is really helpful in that opens up that line of communication. Are there other recommendations that you have that the family can do to help this process?
I would always suggest that the family has one point person. That point person is the one that communicates with the team and then can communicate to the rest of the family. What can happen is if there's multiple children of a parent or multiple caregivers for a child calling in, there might not be a full picture of what's going on. So the story might be getting spread across different people. And it's just a lot easier for everyone involved if there's one person that's getting the full story and then can communicate to the rest of the family. Also, if they can come with the individual to their appointments, it's really helpful to explain instructions to two people. That way, if someone forgets something, the other one might remember. And then there's also a little bit more accountability there as well of like, well, remember the provider told us that we need to do this. So it helps us, give us a little backup too.
Mm-hmm. You know, in light of recent times, over the last several months, we've been dealing with this global pandemic that's been affecting every part of our lives. Based on what's happened, you know, the medical community and people requiring medical care have gone through a lot. What obstacles have arisen that are now being, you know, some of which, you know, are resolving, some of which that are getting better? What are you seeing as a medical professional through that lens?
Well, in terms of patient care, I think patients have had to get a lot more tech savvy. Same with us as providers in order to provide continuity of care during this time. So obviously we don't want our vulnerable populations going out during a pandemic like this. We don't want them to be putting themselves at risk. But on the flip side, we also need to continue to manage their care. Just because there's a pandemic doesn't mean heart attacks and strokes are just going to stop for the time being. So, you know, doing telephone visits, doing video visits, these are things that we've definitely ramped up during this time to make sure that we're still providing care. And then really reviewing, you know, what to do if you are going out, how to wash your hands, things that we might not necessarily spend that much time on in the past. We're spending more time on, I would say, with our patients too.
And how do you help instill confidence in patients if there is a visit that's really important that they do in person? How do you coach them through feeling comfortable and confident receiving medical care if that's, you know, what's being if that's what's really important at this current time?
Yeah, so currently at this point, I think the recommendation still would be to maintain your primary care and continue to go out and receive, you know, colonoscopies and things that you need to get done. And in doing that, advising patients are wearing their mask and washing their hands frequently, encouraging them that Chicago specifically has done a lot of work around protecting its residents. So the masks are required everywhere, and facilities are screening individuals before entering. So they're taking their temperatures, and we're doing screening questions before they're allowed to come in. So if they have any symptoms, if they have any exposures, if they've traveled anywhere, just giving the patient all the information of what's being done on the back end can give them a little bit of peace of mind moving forward. And then also giving them, you know, these are the questions that we're asking, and these are the things that we're seeing. So they also have some autonomy and some ability to, you know, ask questions on their own of, you know, the people that they're encountering. Like, have you been traveling? Have you been sick at all? To maybe make them feel a little bit better.
Those are such great takeaways. I think that being armed with, you know, specific strategies and specific questions can help us all just feel more confident and more empowered going forward for whatever situation it is that we're facing. So Brandy, do you have any additional thoughts that you'd like to share?
One thing I didn't mention in the beginning, but like I said, I have my doctorate as a nurse practitioner, and I often get asked the question, like, should I call you doctor or should I call you nurse? Like, well, how do I address you? And I always tell patients that I did my doctorate. You can call me doctor, but I just don't want there to be any confusion on the topic. So if you're familiar with Dr. Bird went through and got their medical degree, which is a different type of doctor than a doctor of nurse practitioner. So I tell patients a lot of times to call me Brandy or call me Dr. Brandy. So there's something that they can recognize as slightly different than their medical doctor.
Gotcha. Well, thank you. Thank you, Brandy. You are amazing. Brandy Hatcher, nurse practitioner for Rush University Medical Center. Please stay connected to us on Facebook through our 2x2 Health page. as we explore conversations with medical experts from the confident patient in a new world.
And from all of us at 2x2 Health, we wish you great confidence and health. Thank you.